Lung disease doesn't always announce itself with dramatic breathlessness or a persistent cough. Sometimes the body shows subtle clues that most people dismiss as normal aging or just being out of shape. Small signs that reflect what's happening deep inside your lungs. What's important here isn't creating fear, it's creating awareness. Because the earlier you recognize these patterns, the more options you have to do something about them. I am Dr. Suman Paul. I'm a respiratory consultant here in Liverpool. And after over 10 years treating patients with lung conditions, I have seen what happens when preventable disease isn't prevented. Today, I'm going to show you 7 signs of lung disease that most people see every day but completely miss. Before we dive in, 2 important points. First, I'm a doctor, but I'm not your doctor. This video is for educational purposes only. If you have severe symptoms like breathlessness, chest pain, or coughing of a blood, please call 999 immediately. Second, all patient stories that I'm going to share today are composite examples based on my clinical experience. They are not real individual patients. Now let's get into this. The first sign is morning fatigue that doesn't improve. You wake up exhausted even after 7 to 8 hours of sleep. Coffee doesn't help. By lunchtime, you are already thinking about when you can rest again. Most people blame stress or aging, but here is what's actually happening. Your lungs might not be oxygenating your blood efficiently during your night's sleep. When your oxygen levels drop at night, even slightly, your body works overtime. Your heart rate increases, your sleep becomes fragmented, and you never reach deep restorative sleep. You wake up exhausted because your body has been struggling all night just to maintain adequate oxygen levels in the blood. This is particularly common in early COPD, obstructive sleep apnea, and interstitial lung diseases. The airways narrow or lung tissue becomes stiff, making it harder to transfer the oxygen into the blood, especially when you are lying down for hours. In my clinic, when someone tells me they're exhausted despite sleeping well, one of the first things I check is their overnight oxygen level. A simple overnight oximetry test or sleep study can reveal patterns that explain everything. If you are waking up tired every single day despite adequate sleep, that's not normal aging. That's your body telling you something is wrong. Sign number 2, needing to catch your breath after talking. If you are having a normal conversation and you notice you need to pause mid-sentence to take a breath, or you are on a phone call and you find yourself slightly breathless by the end of a long explanation, most people assume they are just talking too fast. But here is what's actually happening. Talking requires coordinated breathing. When your lungs aren't working efficiently, even this simple activity strains your respiratory system. Speaking requires controlled exhalation while your vocal cords vibrate. If your lungs have reduced capacity or your airways are narrowed, you run out of breath faster than normal. I see this frequently in people with undiagnosed asthma, early COPD, and sometimes vocal cord dysfunction. What makes this sign particularly telling is when it's new, when you used to talk for ages without pausing, but now you find yourself stopping mid-sentence. In my practice, I often ask patients to read a paragraph aloud during their assessment. If they need to pause multiple times to catch their breath, that tells me their lung function needs investigating. Sign number 3 is persistent throat clearing. If you find yourself constantly clearing your throat throughout the day, it's not quite a cough, just this persistent need to clear something that feels stuck in your throat. Most people assume it's postnasal drip or allergies, but here is what's often actually happening. Your lungs are producing excess mucus and it's irritating your airways. When your airways are inflamed from smoking, pollution, chronic bronchitis, or even early COPD, mucus production increases. That mucus accumulates in your throat, creating that constant need to clear it. This is different from postnasal drip in key ways. Lung-related throat clearing is worse in the morning because mucus has pooled overnight. The mucus is thicker and more difficult to clear, and it often worsens with cold air, exercise, or irritants like perfume. I had a patient who'd been clearing her throat constantly for 18 months. She had tried allergy medicines, changed her diet, nothing helped. A simple spirometry test revealed early COPD. Once we started appropriate treatment, the throat clearing improved dramatically within weeks. Now, if you are constantly clearing your throat and it's not responding to typical treatment, your lungs might be the culprit. The fourth sign is difficulty lying flat at night. You go to bed and lie flat, but within minutes you feel uncomfortable. You find yourself propping up extra pillows, or you naturally slip on your side or slightly upright. Most people think this is just comfort, preference, or acid reflux, but here is what's actually happening. When you lie flat, gravity no longer helps your lung and heart work efficiently. When your lungs are compromised, lying flat creates the problems. Fluid redistributes, your abdominal contents push up against your diaphragm, reducing the lung capacity, and small airways can collapse more easily. This symptom has a medical name. It's called orthopnea. It's a classic sign of heart failure, but it can also happen in COPD, interstitial lung disease, and severe asthma. What makes this sign important is when it's progressive. When you used to sleep with one pillow but now you need three, or when you have started sleeping in a recliner. In my clinic, I always ask, how many pillows do you sleep with? If the answer has increased over past months or year, that's a red flag. Sign number 5 is changes in your fingernails. You might notice your fingernails looking slightly different, perhaps more curved than they used to be, or the nail bed looks puffy. Maybe someone comments that your fingertips looks swollen. Most people don't connect fingernail changes to your lung health, but here is what's actually happening. Chronic low oxygen levels trigger changes in your fingertips, a condition called clubbing. Clubbing develops gradually over months or years. The tips of your fingers become enlarged and bulbous. The normal angle between your nail bed and the nail flattens out or reverses. Clubbing is associated with COPD, interstitial lung disease, lung cancer, and bronchitis. What makes it particularly significant is that it indicates chronic ongoing disease. It doesn't happen overnight. There is a simple test called Shamrock sign. Place the nail beds of your index fingers together, back to back. Normally, you should be able to see a small diamond-shaped window of light between them. If that window is absent, the nails touch with no gap, that suggests clubbing. If you notice your fingertips changing shape, that's worth investigating. See your doctor. Sign number 6 is unexplained weight loss. You are not trying to lose weight. You haven't changed your diet or exercise. But over the past few months, your clothes fit looser, or the scale has dropped without explanation. Unexplained weight loss is never normal. When your lungs aren't working efficiently, your body has to work harder just to breathe. Breathing becomes more metabolically expensive. You are spending more calories just to maintain your adequate oxygen level. In advanced COPD, patients can burn up to 10 times more calories breathing than someone with healthy lungs. Over time, this increased energy expenditure leads to weight loss, particularly muscle loss. But there is another mechanism, chronic inflammation. Lung diseases trigger systemic inflammation that breaks down muscle tissue and suppresses your appetite. In my practice, I always track weight trend. If someone has lost more than 5% of their body weight over 6 months without trying, that triggers a comprehensive assessment. If you are losing weight without trying, especially with breathing changes, that needs medical attention. Sign number 7 is recurrent chest cold that linger on. You seem to catch every cold that's going around. What starts as a simple chest infection goes to your chest and lingers for weeks. You finish antibiotics, feel better briefly, then within a month, you are sick again. Most people think they have a weak immune system, but here is what's actually happening. Your lungs have underlying damage that makes them vulnerable to infection and slow to recover. This pattern is particularly common in bronchitis, COPD, poorly controlled asthma, and sometimes immunodeficiency. What makes this pattern significant is the frequency and the duration of the infection. 1 or 2 chest infections per year is normal, but if you're getting infection every 2 to 3 months, or if each takes 3 to 4 weeks to resolve, that's abnormal. In my clinic, I always ask, how many chest infections have you had in the past year? If the answer is more than 3, or if they describe infections that last weeks, that triggers further investigations. If you are experiencing recurrent chest infections that never fully clear, that's not bad luck. That's underlying lung damage that needs addressing. Now, here is the thing. Doctors rarely rely on one sign in isolation. What we are looking for are patterns. If you have morning fatigue and recurrent chest infections, that points towards chronic lung disease with possible overnight oxygen desaturation. If you have throat clearing, breathlessness with talking, and difficulty lying flat, that suggests airway inflammation and possible COPD, heart failure, or asthma. If you have fingernail changes and unexplained weight loss, that's concerning for advanced lung disease that needs urgent investigation. The signs cluster together because they reflect the same underlying processes: impaired gas exchange, chronic inflammation, increased work of breathing, and reduced lung capacity. Think of it like warning lights on a car dashboard. One light might mean something minor, but if several lights come on at once, you know something needs attention. The body works the same way. What's powerful about these visible signs is that they can give you a chance to intervene early. Morning fatigue before respiratory failure, throat clearing before chronic bronchitis, and recurrent infections before other complications. That's the window where prevention and early treatment have the biggest impact. So, what you can do? The major modifiable risk factors are smoking, which is the single biggest cause of preventable lung disease. Stopping now will slow disease progression. Environmental exposures, air pollution, occupational dust, chemical, proper protection matters. Physical inactivity, regular exercise improves lung capacity and reduces inflammation. Even 30 minutes of walking daily makes a difference. Untreated infections, getting prompt treatment prevents permanent lung damage. The good news is that many of these signs can improve when the underlying condition is treated. The lungs are remarkably responsive to the right interventions. See your doctor or a respiratory specialist if you have 2 or more of the signs we have discussed: progressive symptoms over weeks or months, recurrent chest infections more than 3 a year, and unexplained weight loss with breathing changes. What to expect in a respiratory assessment? In my clinic, a comprehensive assessment includes a history, spirometry to measure lung function, oxygen saturation monitoring or sleep study, chest imaging, and additional tests as needed. The goal is to identify the underlying cause and develop a personalized treatment plan. Most lung disease develops slowly. It leaves clues, and it's often modifiable when caught early. The visible signs we have covered today aren't there to scare you. They are there to inform you. They are part of your body's communication system. When you understand what they mean, you can take action. The earlier you recognize these patterns, the more options you have. Remember, you don't have to live with breathing difficulties. With the right care and support, most respiratory conditions can be effectively managed. If you are experiencing any of these signs, particularly multiple signs occurring together, I encourage you to seek a comprehensive respiratory assessment. And this is exactly the type of issue I help patients resolve daily at my own private clinics in Liverpool and Manchester. If you are tired of dismissing symptoms or waiting for them to get worse, you can book an appointment with me. You will find the link in the description box below. Thank you for watching. If you found this video helpful, please give it a like and subscribe for more respiratory health videos. I'll see you in the next video.